Good afternoon, NSU students. Thank you again for joining us for our telehealth case competition workshops. Once again, we have an exciting workshop to offer to you to support you as you work towards your research paper and maybe being selected as one of the top teams to work on the live competition. As always, we have some amazing guest speakers that today will be touching upon the maintaining professionalism in the virtual environment, something that's very relevant in telehealth and can support you as you get ready for the big competition. I'm going to turn it over to our two guest speakers to let them introduce themselves and jump into their topic for the day.
Okay, well, thank you, Emilio, and so grateful for the opportunity to partner with your team. Always enjoy the creative and dynamic energy you guys bring to the day. So we're going to be presenting on the topic of maintaining professionalism in the virtual environment. I'm Stephanie Petrovsky. I'm the department chair and program director over the Master of Science in Nutrition program. I've been a registered dietitian for, I hate to say it, almost 30 years. And I started down in this profession because I really truly wanted to make a difference. And I found that nutrition helped me feel better. And I just wanted to do it all my career. And it's turned out to be a really interesting dynamic in terms of how I've used this. So if you're kind of thinking about nutrition as a profession, I'm here now in education and higher learning, but I've also had a very extensive career in clinical practice, both in acute care and long-term care settings, and then health administration, consulting. And I've just had a very interesting, diverse background of how I've used my skills. So, and my partner today is a good colleague and a partner in crime sometimes, I'd even say, Ms. Kim Valenti.
Good afternoon, everyone. And yes, thank you for having us. My name is Kim Valenti. I am the director for our medical education program. It's a master's in medical education designed for health professionals to get those extra skills they need to learn how to be great educators for those interested in teaching later in their career. I came to NSU about 10 years ago and I started in interprofessional education. I was part of grant writing teams that looked for funding for interprofessional education. I'm also the director for interprofessional education for the College of Osteopathic Medicine. Basically interprofessional education, if you've never heard of it, I always joke my job is to get everyone to play in the sandbox nicely, get everyone to collaborate together. It's a great job. I love that aspect of it. So thank you for having us and I'm ready to get started.
You're up.
So telemedicine, I think we can all relate to the joke here, right? I'm sure everyone's wearing pants, but the beauty of telemedicine is that I suppose you don't have to be. Next slide, Stephanie. So today we're going to talk about, and what we want you to take away from it is to be able to define professionalism. We're going to talk a little bit about the technical definition, but also what professionalism means to you individually. Evaluate how professionalism affects interactions with others, discuss the impact of certain behaviors in professional settings, and consider how the virtual environment presents both barriers and benefits. So defining professionalism. According to Webster, who we all know and love, the conduct, aims, or qualities that characterize or mark a profession or a professional person. This is a very technical definition, and professionalism does not mean the same to everyone. It's not defined the same by everyone. But like we said, this is the technical definition of it. And another cartoon just kind of highlighting
that. Actually, it's a great cartoon. So we don't have too many individuals on our call today, but we're recording this and I want to just take a pause moment and see if you could put down or come up with 3 words that you kind of think professionalism means to you. So I do see we have one person on the line. I don't know if you can get to your chat, but if maybe you could just put a couple of descriptive words in there. When you think about professionalism, what does that really mean to you? So we'll get that chat box up and see if we have any input there. Wait for a moment.
And the next slide, Stephanie.
There you go. So not sure. What do you think? Kim, and when I first come up with that, the first thing I think of, just right off the top of my head, so it's good to process that. I was really thinking kind of presence, and also just polished. So there's a little bit of kind of having your act together, but also just genuine, kind of thinking about where you are and being who you are, but in a way that is appropriate to a lot of people. So I'm seeing on the chat, we got honesty and clarity, and good communication etiquette. Attire was one that came in. What
And I
else
like
would you
that,
add?
Olivia, I like that present. And you can feel that. Even virtually, you can feel if someone is present in that communication, which means they have their video on typically. They're not looking down at a phone. They're not looking at a different screen or talking to someone else in the background. So that presence is really important, I think. I also just visually, a clean, simple background for me, and dressed professionally, dressed in attire that I guess I deem professional, but something that someone would wear in an office setting, I feel like you should dress similarly as you would if you were present in the office.
I think that that's one of the biggest challenges right now is we're looking at trying to understand our new world in the virtual presence, that the boundaries have been blurred about, getting yourself ready. I actually interviewed somebody yesterday who made me think of it in such a way as that even though she didn't have a car commute, she had a mindset commute, is how she described it, so that she would keep her routine and kind of get dressed, do the shower thing, and really get herself ready for work, even though she was just going to her living room. So what do you think about the presence or professionalism of social media and impacts kind of overall? So we actually thought when brainstorming a little bit for this that there's so many different ways that virtual environments could touch our lives and have really been changing the way we work with each other. So I love this slide. Kim, you want to explain a little bit of where that all came from? Dolly Parton and the many faces of Dolly. Yeah.
Yeah, just as Stephanie and I were preparing for this presentation, we were talking about how that social media presence translate. I think we know as being on this academic side of things, being directors of program, when we interview people for employment, when we interview students for the programs, we are going to Google names, we are going to look things up and see that online presence. So I think this is a very telling kind of meme. How your LinkedIn profile looks can be very different than Facebook, Instagram, Tinder, but just keeping in mind that while you have those different personas depending on the platform, at times those are very visible to employers, to program directors, to deans of a college. So just keeping that in mind, and this was just kind of a funny way to translate that.
I actually have actually been on admission committees, and for many times I've been a part of decisions on medical school and employment decisions, where somebody would take the time to Google the name of the applicant and see what comes up. So I often tell students, and I see Olivia's making that suggestion, to Google yourself. If you haven't done so lately, put your name in that search bar and see what comes up, and make sure that it's that ambience and presence that you want. So thinking about your own mindset and how you want to be portrayed and received by people that you don't know, or just using those nonverbal cues for impression is really important. So I cracked up with the Tinder one. See, we don't sometimes think about how our personal lives do cross into that social media. But also when you look at business meetings, there's a lot of great commercials out there now. The insurance industry is having a lot of fun with Zooming, and now these scenarios about how people can even communicate effectively is really a challenge. Sometimes it can really bring us some improvements, and it can also bring us some challenges. But education's another whole realm, and all of you are experiencing it as well as we are coping. And I think while we've really enjoyed the efficiencies of Zoom, it's probably changed the future of how healthcare and education is going to be, because we have learned a lot of really great benefits from it. And I think it is connecting people in a way that we never had a chance to do. So it's good to rethink it and definitely think about the background and environment that you're using it. So anything else on this slide before we move on?
I'd also, just from a personal experience, want to say, I'd also be careful about switching between these, right? So a lot of us, like I say, especially in this time of COVID, you're using your Zoom maybe for social gatherings, and then you're turning around and using them for an interview, and then you're turning around and using them for class or for a business meeting or for a telehealth appointment. And I recently had a student who signed on to one of my information sessions and had not changed her name from a social gathering that she had had previously. And she was a resident and was signing on to get more information about a master's program, and had left her name as Dr. Dimples as a joke to her friends, but then realized she had never changed it in switching between these things. So one of the other things I would maybe mention is preparedness. When you're going into a meeting, if you sign on early, you can check things like your name. You can check things like, what's in the background, because you'll have that. She got very flustered doing it right then because she didn't realize, profusely apologizing, which was fine. But just something else to think about as you switch from, your social Zoom persona to your business or your classroom Zoom persona.
Yeah, that's a good reminder that, that old adage, you never get a second chance at a first impression. And I can definitely attest that I've been on a Zoom meeting waiting for people to come in that were maybe finishing a conversation, had their mic on, got up to shut the door, and we saw their legs instead of pants, so those are definitely things to think about and be mindful in that virtual environment, creating that presence that you want to walk away with. So a couple of words of wisdom. I don't know if many of you even know about Mr. Rogers' Neighborhood, but I grew up with him, and they made a new movie about him recently. But this is a really good quote. So I want to just stop a moment and appreciate what he said. You could only sense how important you are to the lives of those that you meet, and how important you can be to the people that you never even dream of. And there's something of yourself that you leave at every meeting with another person. So that's pretty powerful when you think about that in terms of this context as well, that you give a lot more than you think you are communicating by who you are and what you're presenting in your environment. So think about that. That's a really good quote. And moving on, I think it's good that we think about the benefits and the barriers. So this would be a good point to just get you guys to help me out with, what do you think if we kind of look at the year of COVID and Zooming, what do you think some of the benefits have been? What have you seen? So what do you think? Put some ideas there in the chat. See what you guys come up with. What do you think benefits? One or two things that come to mind that you've really benefited from. So let's just focus on benefits first. I'm here seeing a couple of barriers. So what would you say? Great. So I'm going to kind of move along since we don't have too many participants today. So on the left here, I've got some benefits ready. So obviously it's very convenient. I love the fact that I could turn my meeting off and, hit the restroom, get a snack, and be back in 5 minutes. It's not normally easy to do that in the office. Very efficient in terms of just getting a lot of productivity. We've joked at work that we're actually doing more at home in the virtual environment, and to the benefit side, that maybe that's actually not so good because we're working maybe a little bit more than we should in work-life balance, but we're getting connected to people. So extended reach, and this is really important in the telehealth idea, is that with Zooming, you think about the critical situation and the access and not exposing people to illness, but also reaching into rural areas or maybe people with transportation concerns. So we are able to now, deliver services in a way, but multitasking and productivity. So we definitely feel that. And then collaborations, just getting everybody together, just enjoying the face-to-face that we can have without being physically in the same room. But even jumping on documents, we started really thinking about the cloud and the support system and how we work together, even in writing collaborative presentations or practicing or just getting together real quick on the Zoom to do a meeting. So what about some barriers? We've got some ideas that popped up in the chat there in terms of technical access, internet, especially when the internet crashed. Who would have expected that to happen just a few weeks ago in Miami? It was a big deal. But it's sometimes because we are so convenient with it, we tend to let it become a little more casual. And I've actually seen this quite a few examples in a negative way where people are, on the phone and they're, the phone shaking through the grocery store, or they're in a car and, you're watching everything that's happening, but that they've got their mic off and they're totally laughing and having a fun time, and they're not paying attention to the meeting. Why are they even wasting everyone's time being on the meeting? So those kinds of impressions come through when individuals just really are a little bit more casual about the interaction. But in our home environments, those barriers are there. We're crossing these lines. Where is the end of the office and the beginning of my bedroom? My husband and I are working that out all the time. I have a little screen that goes around with me to try to create that professional environment, but sometimes it's time for his lunch, and I've got to be quiet while he's cooking in the kitchen. So
I had Stephanie, I'll just say I
yeah.
had 2 small children home with me for about 10 months through COVID, and I would add a slide to my presentation or add a line to the disclosures part of my presentations that I gave, saying that kids may interrupt this session. And it was part of my disclosures because to tell a 4-year-old to go sit down, I just wanted to let people know what the situation was and that, this could happen, trying to make a joke, but staying professional.
That's actually a really great example about trying to take those circumstances and mitigate. Like I have it here, the photobombs and the lawnmowers. Who hasn't been on a phone or a Zoom call where somebody, of course, starts banging or working right when you're in the middle of the key piece of the interview or the presentation? And I've even called doctors, my own telehealth experiences, where they were in their home environments and the same thing happened on that end. But I really love what you said in terms of being just upfront and professional and kind of giving that information so everyone kind of knows what to expect. But of course, just really, the technology in general. What happens if in a telehealth appointment, for the first time, you've never used telehealth, you have inexperience? What about a senior citizen who maybe doesn't have the same skills that you might have on a phone? So definitely, considerations in telehealth in general and just the virtual environment. So take it away, Kim.
Sorry about that. I think
that was a test, right?
Yeah, this is my first time Zooming. So I think we're all aware that the telehealth surge, the world shut down in March and we all kind of went online as quickly as possible. Took longer for some than others, but overall, according to the CDC, there was a 154% increase in telehealth visits in the last week of March 2020. So that meant compared to the same time in March 2019. So that means, everyone who had those appointments, who needed those appointments for the end of March, providers really tried to quickly get online and crank out these telehealth. And going back to my earlier statement, how prepared was everyone to do that? These providers very quickly went from treating patients and seeing patients in person to doing it on telehealth. So just to give you an idea of how large scale that really was, the surge in telehealth. Again, in Massachusetts, for example, Blue Cross Blue Shield paid for about 200 televisits a day before the pandemic, and now nearly 40,000 televisits a day in recent months. And that's just Massachusetts. I mean, imagine all over. So that's just kind of a background, or giving you a scale of how large we're really talking in terms of the number of people getting their healthcare online at this point. Something else I think is really important to take into consideration, and I've kind of seen this with the vaccine rollout in Florida, being mindful of access and diversity. On that telehealth, you're taking your practice, you're moving it to telehealth, and as a provider, you're going to start providing telehealth services. You need to be mindful that not everyone is well versed in Zooming and internet, and they may not have a computer. So just to kind of back that up, an American Heart Association found that non-English speaking female, those with lower median household income, and older patients were less likely to show for their telemedicine visits. So it starts to kind of beg the question of, how do we reach those audiences if this is not something that they're comfortable doing? And so I think that's really important from a professional perspective to keep that in mind, and to work with those patients on ways that you can bring them into the loop and get them seen if you cannot see them in person. You know, when you talk non-English speaking or English not being the first language, what is the, being prepared again with interpreter services, even in a telehealth environment, and what do those look like, and shop them around. And, you still want to provide that really top quality care to your patients. Likewise, when we're talking about professionalism, they did a study, a very large study, and found that marginalized populations, they report greater infringements on their professional boundaries, as well as increased scrutiny over how they behave professionally, and a tension between inclusion and assimilation. So I think going back to that first question that first slide where we defined professionalism, different groups define professionalism a little bit differently. What professionalism means to me and what I'm comfortable with may not be the same as Stephanie or Emilio or Olivia. It's different to everyone, and to just be kind of mindful of that as you're dealing with a very diverse group of patients or clients.
I think that's a really good point to stop and think about your own assessment as you work through this case study, this case competition that you're doing, and as you move forward in your own experience and careers. Really looking at implicit bias. There's a bunch of self-assessment tools you can look up online, so you can start to recognize and be aware, and maybe even intentionally change how you just really embrace diversity and successfully navigate working with people that are different than you. And when you see that on Zoom, you can really visually see the diversity. But sometimes those subtle differences come out in the way we communicate, the way we present ourselves to an appointment, how responsive, or maybe even how open and transparent we could be in conversations with people that are coming from a different perspective. So it really is, I think, on the onus is of the professional to take responsibility and understand how they feel about that, and where they're growing up and their own culture has influenced them, and their own experiences and interacting with people. So any last thoughts on that, Kim?
And while it might not be a reality, I can't determine how everyone's going to feel. Maybe I'm doing something that I think is very professional, whereas someone else may not think so. So I think to think about things, as Stephanie said, transparency and statements like, are you okay with me doing this? Are you comfortable if I share this information? Or, you know what I mean? Just maybe asking that question and being transparent to make sure that your client or your patient feels comfortable.
That's actually another good point too, about language barriers in a telehealth setting. It's easy to have people from the family or the group, the friendship that you're talking with a patient, for example, have them come in and translate. But that's kind of a dicey situation in health conditions because familiar language may not translate exactly, and then they may not be able to give from a health provider back the exact information. So in a professional setting, say for a hospital or some other type of health services, we would have professionally registered interpreters. So that's kind of an interesting variable. A lot of times we depend on family and even co-workers in the setting that would give more informal translation to try to help in that communication. But that's another interesting dynamic that I think more and more will start to come up in the telehealth, is that language and really getting translation effectively done so people are safe on both sides. Because in medical practice, we have to get informed consent. And how do we know they're informed if we don't really communicate and know that they have understanding? So to be continued for sure, but good point in our presentation to think about diversity, our own impressions, as well as our behaviors that it really show that inclusion. So we have just a kind of a wrap-up activity that we would like for you to take a couple of minutes to participate in. Just even if you're listening to this recording, I hope that you will take a few minutes. We're going to just take this a little bit slow. So the first reflection is for you to think about a virtual experience. We've given a lot of examples, and think about something that really hit you as negative during that example. Could be telehealth. I know Kim has a quick story of her telehealth experience, but I want you to think about briefly in your mind what went wrong in terms of professionalism. So just take a notepad or a phone, just kind of jot a couple of thoughts down. And Kim, I want to ask you to share your story.
Yeah, I recently had a telehealth appointment, and my physician, who was not seeing patients in person at this point, it was interesting to me, and not that it bothered me per se, but I did take note of how relaxed she was. She was sat back in her chair. She was very comfortable. She was not dressed, not as I would see her in the office. She had on, I think, maybe a sweater or something, but it wasn't, I don't know. She didn't look the same as I usually see her in the office, which again, didn't bother me so much. But I was going to the appointment because I had been having kind of allergy issues, and I didn't know, a new cat, the dry air in my house, whatever it may have been. But one of the symptoms was kind of my throat seemed irritated, but there was no way for me to really show her that, or it was just, we just both kind of sat there, and I was like, she's like, well, it could be this, it could be this, it could be this. But she couldn't look in my throat. She couldn't feel my lymph nodes. She couldn't do anything physical for me. So I kind of left the appointment feeling like it was not that helpful, and ended up going to an ENT who was seeing patients in person.
I remember when you told me that story, you mentioned that you really left that saying, I miss the white coat.
Yeah,
there was something about that interaction.
Something.
Yeah, that you didn't feel like you had really had the services that you were looking for.
Yeah, I didn't feel, without the touch and the being able to look in my throat, and it was kind of a guessing game on what was going on, and she really couldn't tell how serious it was. I couldn't really communicate I was like, well, it's kind of dry but kind of scratchy, I don't know, I'm not medical terms here that I was using.
I think it would be interesting to think about it from the practitioner side, the provider side, to even ask them about the quality of patient interactions and the concern that they have about making good diagnosis with the limited amount of information, because we're really going on the patient history and not so much that physical exam. And then you get into troubleshooting more than really full practice of medicine. So good points that we bring out. So something kind of negative. If you need a couple of minutes, just hit the pause button. We're going to keep moving on with our session today. Did you want to say something, Amelia? to that?
Yeah, I've run into some of these, and I think it's similar to what has been mentioned. Is just understanding the virtual world. I think, especially when COVID first hit, that we were all adjusting to the Zoom world. My job involves so much relationship building with faculty and employers, and I think understanding when you need to have your camera on or not have your camera. I think for workshops and for classes, it's understood. Hey, sometimes I could have my camera off and take a back seat. Um, and I had to have a conversation with someone that joined me for an employer meeting where me and the entire team of the employers had their camera on, and the individual that joined me did not, and kept themselves on mute and without the camera the entire time while everyone was trying to engage and connect as much as possible. And it definitely took something out from the meeting. And I had to have a professional development conversation with them. But it wasn't something that they were aware, because if it was in person, it would be just normal. And usually they're there sitting back and listening, where in this case, they could have done the same, but just having their camera on show that they were engaged in the conversation. And so nothing that was, terrible. It was just more like we were adjusting to the new world that we were in. And the camera being on and off is something that I think everyone was kind of adjusting to, in terms of, hey, my normal day now is on Zoom every day. And I know for myself, I always have my camera on. I'm always aware of my background, but I want people to see my face, even if they don't feel comfortable putting on their camera. I think it kind of makes them feel like I'm really engaged. And considering I'm building relationships, especially new ones, it's very helpful that they can see my face, even if they don't want to show their face.
Really good point about the signaling of having your camera on. And there's a lot of brain absorption happening with looking at people. It's intense all day long, especially in the education realm. So as an instructor, a way that I deal with that is I kind of give my audience sometimes permission, turn your camera off. We're going to just have 5 minutes to work on an activity alone, and then we're coming back here in 10 minutes or something like that. It allows for the brain to disconnect a little bit and relax. And some people I've heard are very self-conscious, so even changing your view so you're not looking at yourself, but you can have more of a normal conversation. And just the other day I was having a chat with a faculty member and trying to help students, what's the difference between that kind of laid back attitude with the camera off and listening in during a class, for example, when they were sitting in the class a year ago physically. There's not much of a difference except the body's in the room. And the people are still checking out. They're on their phone and they're thinking about their grocery list, or they're thinking about other things. They're not really engaged in the classroom. So now you have that physical presence disrupted, and so the virtual presence becomes so more meaningful in terms of what people are processing about your engagement and your attitude. And I think that's a really good point in the beginning of a session to ask permission or kind of set the ground rules about how we're going to move forward, and that we get all our kind of expectations, especially in the working group in work, kind of set up how we're going to operate going forward. That when we're together, where cameras are on, unless we're in a place where we can't be present. So back to our little reflection. We've got two little quick questions for you to think about and apply from this presentation. So I want you just to, for a moment, imagine yourself giving a presentation. Maybe it's for the case competition, or maybe it's for something you're doing in your semester coming up this week. Think about, before you begin your presentation, because you're busy writing all the content, you're putting all this together, maybe working with your group members, trying to get them to get on the job. What would be 2 or 3 to 5 terms of something you want to come away, what you want your audience to come away with? So a lot of this is putting yourself in the shoes of the people that you're speaking to. What kind of impression would you want them to be? And I'll just take a moment to acknowledge Jerome. Thank you for being with us today. And he mentioned in the chat, one example would be a meeting he was in, speaking over each other. So everyone kind of talking at the same time, communication became unclear, no appropriate moderation. Really good, important tip, trying to facilitate those meetings so we can say, call on individuals, say, okay, now we're going to do this, and give direction throughout that meeting. Excellent point, Jerome. So Emilio's added that his terms would be engaging, motivating, professional, polishment, and Olivia wants to be informative and compelling. The mysterious compelling word. So that's good. I think it will help you visualize what you want your outcome to be if you really speak that out and make sure that along the way in your communication that you're intentionally doing something in your virtual presence to give that across. So I noticed, for example, Olivia's nodding her head a lot. She's showing me I am compelling. I am taking in all this information and totally using those words. And Emilio, he wants to be motivating and professional. He took the time before we got going to close the blinds behind him so that I didn't see this big glowing, blinding light. And he's sitting there with his nice professional collared shirt and he's all shaved and ready to go. I like the new glasses, by the way. So think about that. Think about what you want to come across. And then last, for you to kind of wrap that, reflection up, in order to achieve that desired impression, what will you do the next time you get into that interaction? So those are some words of wisdom, and we got a wrap up slide, and take it away, Kim.
Okay. So the telehealth etiquette, this is, well, it seems kind of that it goes without saying. I think we've all been in enough situations that perhaps these are just reminders, and things that in busy lives sometimes can be forgotten. As I said, the person who forgot to change their name. I think most of us, if not all, have seen the lawyer as a cat video. Another unfortunate situation in a professional setting that I'm sure, had he been prepared and signed on and been able to take that off, would have done so. So just some things to remember. The business attire, this can be different depending on what fields we're talking about. As Stephanie mentioned, I kind of wanted that white coat. I kind of wanted something that said, I'm your physician, something. But it could be in a business meeting, anything. So whatever the business attire is that you're used to wearing within the office, I think that would translate or should be some continuity in telehealth as well, or in your business meetings. Check out your audio, video, internet settings ahead of time. Something else that I can speak to is having a backup device if you're doing something, maybe a telehealth appointment or something in an important meeting. I was giving a presentation once and my computer died. Didn't die because I didn't have it plugged in. It was just something went wrong. And because I didn't have another device ready and waiting to go, that cost me valuable time and was not a professional look when I was trying my hardest, flustered, trying to log back on. So having that set up ahead of time and being prepared is really important. Having your camera on, we just spoke to this, kind of having your camera on, being present, being engaged, and properly positioned. Be mindful of what you have in the background. I think we've also seen memes and things with people who have very inappropriate things in the background of their video chats. We don't want to be those people. Lighting is critical. You don't want to be too bright, too dark in your lighting, because it will affect your video and how everyone is able to see you. Quiet and focused. I go back to when I had 2 children at home. It was difficult, but trying to ahead of time create that quiet space where you don't have a lot of noise, and so that you can focus on what it is you're trying to do. Muting your microphone when not speaking and remembering to unmute when you go to speak. Also very important. Address people with proper names and titles. This is important in person as well as virtually. And no eating and snacking. I know in more informal meetings, if I am needing to eat because I've just had back to back meetings, I'll let everyone on the meeting know. I'll turn my camera off while I eat and then come back into the meeting and still try to be present. If that's not okay, if they'd rather you be engaged or rather you be, sorry, not engaged, but present, I can wait to eat. So just some tips, tricks, the etiquette for telehealth or any virtual online interaction.
Thank you both so much for all those insights. I know this is going to be super helpful for our students when we get it on the Canva course. And just want to thank Kim and Stephanie for taking time out of their day to share their insights, share something that is very relevant and new trends in professionalism, because I think over a year ago, we were not all aware of how the virtual world could affect how our interactions and our professionalism and things we take to granted when we're working from home or, and things are just in a Zoom world. So I wanted to thank you both again. And once again, students, we hope you gained a lot from this. The recording is going to be on our YouTube channel, but for those that are our competitors, it is going to be on the course module by the end of the week. And so Kim and Stephanie, thank you again, not just for this, but being collaborators for this case competition. We are really excited and we appreciate everything you've done for our students.
Of course. Thank you.
Happy
Thank you for having me.
communications. Bye-bye.